Welcome to our deep dive. Today, we're going to be looking at a study in veterinary neurology.
Oh, cool.
Yeah, you actually sent this one in to us.
I did, yeah. This one I was pretty interested in.
Yeah, and it focuses on paraplegic dogs.
Right.
Specifically those who can't feel pain in their hind legs and how they recover after surgery for slipped discs in their lower back.
So these dogs have thoracolumbar intervertebral disc extrusions.
Okay.
And they were unable to walk because it was so severe.
Wow. So right off the bat, we're dealing with a pretty significant spinal cord injury in these dogs.
Absolutely.
The first thing that jumped out at me was the overall outcome.
Okay.
Despite the severity of their condition,
Yeah.
a surprisingly high percentage of dogs regain the ability to walk after surgery.
Yeah, over 60%.
Really?
Yeah, which is really encouraging for owners facing this diagnosis.
That's a huge beacon of hope.
Yeah.
Now, delving a bit deeper into those outcomes,
Okay.
the study found that over half of the dogs recovered both their ability to walk and pain perception.
Yeah, 53.5%,
Wow.
which is fantastic.
That's remarkable considering the initial severity of their paralysis.
Right.
But what about the dogs who didn't regain pain perception?
Okay.
Were they still able to walk?
So a small percentage, about 7%, were able to walk, but without regaining pain sensation
Interesting.
in their hind legs.
Okay.
And that's called spinal walking.
Spinal walking.
Yeah.
I've heard of that, but it still sounds a bit like science fiction to me.
I know, it's really fascinating.
Oh.
It's not fully understood,
Yeah.
but it's thought to involve reflex pathways in the spinal cord
Okay.
that allow for walking movements even without input from the brain.
So essentially, the spinal cord finds a way to work around the injury
Exactly.
and generate those walking patterns independently.
It highlights the incredible adaptability of the nervous system.
It really does.
Yeah.
What's even more intriguing is that all the dogs who exhibited spinal walking were under 33 pounds.
Right.
Is there a connection between a dog's weight and their ability to walk without pain perception?
That's one of the burning questions that this study raises.
It really does.
Yeah, it certainly warrants further investigation to
Yeah.
see if there's a relationship there.
Now let's talk about a procedure that's commonly performed during these types of spinal surgeries.
Yeah.
Durotomy.
Yes.
Can you explain what that entails?
Yeah, so a durotomy is an incision made in the duramater,
Okay.
which is that tough protective membrane that surrounds the spinal cord.
Gotcha.
It's often done to relieve pressure on the spinal cord
Okay.
or to allow for better visualization during surgery.
So intuitively,
Right.
you'd think it would be beneficial for recovery.
You would think so.
But this study found something quite surprising.
Yeah.
Dogs who had a durotomy alongside the standard Hemilaminectomy
Right.
were actually less likely to walk again.
I know, isn't that crazy?
That's counterintuitive.
Yeah.
Why would a procedure meant to help the spinal cord hinder recovery?
That's the crux of the matter.
It really is.
It challenges conventional wisdom about durotomies.
Raises a lot of questions
It does.
about their potential impact on the healing process.
Yeah. One possibility is that the dogs who required a durotomy already had more severe injuries,
Okay.
and those injuries were the primary factor influencing their outcome.
So the durotomy might not have been the cause of the poorer outcome,
Right.
but rather a marker of a more severe injury.
That's one interpretation.
Interesting.
However, it's also possible that the durotomy itself interfered with the healing process in some way.
Okay.
More research is needed to unravel this.
It's a complicated relationship.
It is.
This finding certainly highlights the importance of carefully considering the risks and benefits of any surgical procedure.
Absolutely. Each case is unique.
Yeah,
And it's crucial to weigh all the factors involved before making surgical decisions.
for sure. This study also looked at the role of spinal shock
Yeah.
in predicting recovery outcomes.
Right.
Could you explain what spinal shock is
Sure.
and how it factored into the research?
So spinal shock is basically a temporary shutdown of the spinal cord
Okay.
after an injury. And it's characterized by a loss of reflexes
Okay.
and muscle function below the level of the injury.
So it's like the spinal cord is in a state of shock after the trauma.
Exactly.
Okay.
And the study found that dogs who showed signs of spinal shock, particularly in combination with reduced or absent withdrawal reflexes,
Right.
were less likely to walk again.
This suggests that these dogs may have sustained more severe damage to the spinal cord.
That's the interpretation, the
Yep.
combination of those two factors.
Could indicate a more challenging prognosis for recovery.
Yeah, for sure.
Now, there's often a lot of discussion and concern among dog owners,
Right.
especially French bulldog owners,
Yeah.
about the prognosis for recovery after these types of spinal surgeries.
There's a misconception that French bulldogs have a worse prognosis
Okay.
for walking again compared to other breeds like dachshunds.
And this study directly addressed that concern.
It did.
Okay, what did it find?
The findings were quite reassuring for Frenchie owners.
Oh, good.
There was no statistically significant difference in recovery rates
Wow.
between French bulldogs and dachshunds.
So both breeds had similar chances of regaining their ability to walk.
That's right. The study debunked the myth
Cool.
that French bulldogs have a poorer prognosis.
That's excellent news.
Yeah.
However, I know there's another concern specifically about French bulldogs.
Okay.
A higher risk of developing a serious complication called myelomalacia.
Right. Myelomalacia is a softening or disintegration of the spinal cord,
Oh, wow.
and it can be devastating.
Did the study shed any light on the incidence of myelomalacia in French bulldogs?
It did. The study found that only a small percentage of French bulldogs developed myelomalacia.
Really?
Yeah, much lower than previously reported.
So another misconception debunked.
It seems so.
Wow.
This research provides valuable evidence to challenge those assumptions
It sounds like it.
and provide a more accurate understanding of the risks and potential outcomes.
Yeah, shifting gears a bit. Let's go back to the dogs who were able to walk again
Okay.
without regaining pain perception.
Right.
This spinal walking, as it's called,
Yeah.
is fascinating but also a bit puzzling.
Yeah.
If they can't feel their legs, how do they know where they're going?
That's the beauty of spinal walking.
Oh,
It's not a conscious, deliberate movement that requires sensory feedback from the legs.
Okay.
It's more of an automatic, reflex-driven action.
So their legs are essentially moving on autopilot.
In a way, yes.
Okay.
The spinal cord itself, even without input from the brain,
Yeah.
can generate rhythmic patterns of muscle activity
Gotcha.
that allow for those basic walking movements.
But wouldn't they be bumping into things or falling over if they can't feel where their legs are?
So many dogs who exhibit spinal walking actually develop a heightened awareness
Okay.
of their surroundings.
Interesting.
Using their other senses, particularly vision,
So they're compensating
they learn to compensate
by relying more on their vision?
for the lack of sensation by relying more heavily on visual cues
That makes sense.
to navigate their environment.
It's like their brains rewire themselves to adapt to this new way of moving.
It's a testament to the plasticity of the nervous system
Yeah.
and the remarkable ability of the brain to adapt even in the face of significant injury.
Now, this study also looked at the specifics of the spinal surgery itself,
Okay.
particularly the hemilaminectomy procedure.
Right. A hemilaminectomy involves removing a portion of the vertebral bone
Okay.
to relieve pressure on the compressed spinal cord.
And they compared outcomes based on whether a single site or multi-site hemilaminectomy was performed.
Exactly.
What did they find?
Initially, it seemed that dogs who had a single-site hemilaminectomy,
Okay.
meaning only one vertebra was operated on, were more likely to walk again.
So a less invasive surgery was associated with a better outcome.
That was the initial thought.
Yeah.
However, when they factored in other variables,
Like what?
like the presence of spinal shock and whether a durotomy was performed,
The extent of the surgery wasn't as strong a predictor of recovery as those other factors.
so it's a complex interplay of variables,
It is.
and the extent of the surgery is just one piece of the puzzle.
Precisely. It highlights the importance of looking at the whole picture
Yeah.
and considering all the factors
Right.
that might influence a dog's recovery.
So we've talked a lot about the different factors
Yeah.
that can influence recovery from spinal surgery.
Right.
But I'm curious about what happens after the surgery itself.
Okay.
What does that rehabilitation process look like?
Sure. So rehabilitation is crucial
Okay.
in helping these dogs regain strength, coordination, and mobility.
So what kinds of things are we talking about?
So it typically involves a combination of physical therapy,
Okay.
targeted exercises, and assistive devices.
Can you give some specific examples?
Yeah, so physical therapy might include massage stretching
Okay.
and range of motion exercises.
So it's all about getting those muscles moving.
Exactly.
Yeah.
It helps improve flexibility, reduce muscle stiffness,
Okay.
and promote blood circulation
Gotcha.
to the affected areas.
And then what about therapeutic exercises?
So therapeutic exercises are designed to strengthen specific muscles,
Okay.
improve balance, and encourage proper movement patterns.
So what would that look like?
That might involve walking on a treadmill with support,
Okay.
swimming, or performing targeted exercises
Okay.
to engage the core and limb muscles.
So it sounds like a very tailored approach,
Absolutely.
focusing on each dog's individual needs.
Exactly. And in some cases, Assistive devices can be helpful too,
Okay, like what?
like harnesses, slings, or even wheelchairs
So they can move around more easily.
to provide support and stability,
Makes sense.
especially in those early stages of recovery.
Right when those muscles are still weak.
Exactly.
Now, we focused a lot on the physical aspects of recovery,
Yeah.
but what about the emotional toll
Right.
that these injuries can take on dogs?
It's important to remember that spinal cord injuries can be traumatic.
Both physically and emotionally.
Of course.
Dogs may experience fear, confusion, anxiety,
Wow.
even depression.
So emotional support is just as important as physical therapy.
Absolutely. Owners play a crucial role
Okay.
in providing that emotional support.
Yeah. Are there specific things owners can do to help?
Yeah, spending quality time with their dog,
Okay.
speaking to them in a soothing voice,
Hmm.
providing gentle petting and affection,
Okay.
can all help to reduce stress
That makes sense.
and create a sense of safety and security.
Is there anything else they can do?
Maintaining as much normalcy as possible is also important.
Right. Routines can be very comforting for dogs.
Exactly. Sticking to their regular feeding schedules,
Yeah.
offering safe and appropriate playtime,
Okay.
and adapting their walking routines
To accommodate their physical limitations.
to minimize stress and promote a sense of well-being.
It sounds like the key is to provide a supportive and loving environment
Precisely.
that encourages both physical and emotional healing,
It's a journey of recovery and adaptation.
both for the dog and their owner.
Yeah.
This deep dive has been incredibly insightful.
Good. I'm glad to hear that.
We've explored a range of topics.
Yeah, we have.
From that surprising finding about durotomies
Right.
to the remarkable phenomenon of spinal walking,
Yeah, it's fascinating.
where dogs can regain the ability to walk,
Yeah.
even without regaining pain perception.
This study highlights the complexities of spinal cord injuries in dogs
It does.
and emphasizes the need for individualized treatment approaches.
It also underscores the remarkable resilience of the canine nervous system
It really does.
and the incredible potential for healing,
Yeah,
even in the face of severe injury.
absolutely. From Vet NeuroJar, keep those minds inspired.
Yes.
Hearts light and tails wagging.